In this video, I will be discussing the nutritional considerations involving the challenges that patients with Duchenne muscular dystrophy face. Duchenne muscular dystrophy, or DMD, is a muscle degenerative disease that is genetically inherited mainly by boys. DMD is characterized by mutations on the dystrophin gene that results in an out-of-frame mutation, leading to the loss of dystrophin protein function. DMD has a 100% mortality, and there is currently no cure. Multidisciplinary approaches and therapies are crucial for DMD patients in delaying the progression of the disease and improving the quality of life. Nutritional challenges of DMD will arise as the disease progresses. Overnutrition typically occurs from preteen to teen years, while undernutrition usually occurs after teen years. Overnutrition or undernutrition cases have adverse effects on various aspects of a DMD patient's health. In this video, I will discuss how overnutrition can lead to obesity, diabetes, hypertension, and excessive muscle exertion, and how undernutrition can lead to dysphagia and negative effects on gastrointestinal and bone health. I will also talk about some dietary considerations to make with each case. Note that this video is made for a class project and that the case of each patient is different, so please consult with your health professionals to guide your decisions regarding the various aspects of care and therapies for DMD. Physical activity and exercise is limited for DMD patients to avoid overexerting muscles that would otherwise accelerate muscle damage. Along with reduction of physical activity, medications that DMD patients take, like corticosteroids, stimulate appetite and therefore also contribute to overnutrition. Chronic use of corticosteroids can also increase the risk of insulin resistance. Normally, insulin is produced from the pancreas to allow glucose to go from the bloodstream into cells to power cellular processes. Corticosteroids affect fat and liver cells from responding to insulin, leading to increased levels of glucose in the blood. High levels of glucose in the blood as a result of insulin resistance and/or insufficient production of insulin will lead to hyperglycemia. Corticosteroids also increase visceral fat, which is where fat is stored in the abdominal cavity. Hypertension, which is high blood pressure, is also commonly observed. These are all risks associated with obesity and diabetes. Being overweight as a result of overnutrition will overexert the muscles and respiratory functions, which would further increase muscle damage and therefore quicken the progression of the disease. Because exercise is not a feasible approach for DMD patients to reduce or prevent overnutrition, it makes nutritional planning an even greater concern in order to control calorie and glucose intake. One aspect to consider is limiting simple carbohydrates and instead turning to complex carbohydrates. Simple carbohydrates have a high glycemic index, indicating that it gets digested faster, therefore rapidly raises glucose levels in the blood. This is seen in foods that are already normally considered unhealthy, like candy, donuts, ice cream, and soda. Complex carbohydrates have a low glycemic index, so it would take longer to break down, and therefore there will be slow, small changes to glucose in the blood. Some examples of complex carbohydrate foods are dried beans, fruits, and whole grain bread. So DMD patients facing overnutrition challenges should avoid foods with simple carbohydrates and instead look to foods with complex carbohydrates. Another aspect of overnutrition to consider is limiting the consumption of trans and saturated fats, which are often associated with promoting diabetes and high cholesterol. They can be found in fried fast food, red meat, and butter. Instead, unsaturated fats are a better option, and some examples of this is olive oil, fish, and avocados. In addition to the mentioned aspects, it is also important to consider portion size control, which would vary for each patient and should, along with other dietary aspects, be guided by nutritionists and health professionals. Undernutrition typically occurs in the later stages of DMD as muscles become progressively weaker. As the oral muscles weaken, this leads to dysphagia, where patients have a difficult time swallowing and increases the instances of choking and can lead to aspiration pneumonia. So difficulty consuming food would further contribute to undernutrition. One dietary consideration to make with this issue is to incorporate softer and pureed foods or thin liquids into the diet. The overall goal of undernutrition challenges is to maximize calorie and protein intake while minimizing the amount of food consumed, especially in the cases of dysphagia. Undernutrition can also lead to gastrointestinal issues involving constipation. This occurs as the disease progresses, where the smooth muscles of the colon become weak, causing slow GI transit, leading to constipation issues. Increasing fiber and hydration in diet can be implemented to help with these issues. Fluid intake is suggested to be around 1 ounce per pound of body weight. Undernutrition and corticosteroids are also reported to reduce bone health and mass, and this increases the risk for scoliosis, fractures, and osteoporosis. Nutritional considerations can involve taking calcium supplements and increasing calcium intake through food. It is also suggested to reduce sodium in diet, where it is recommended to not exceed 1,500 milligrams of sodium, which is about 3/4 of a teaspoon per day. Percutaneous endoscopic gastrostomy, abbreviated as PEG, is a procedure performed to put a feeding tube into the stomach, which allows for a direct delivery of food to stomach without passing through the mouth and throat. PEG is recommended if patients aspirate while eating, if meal time is prolonged to over 30 minutes, and if oral feeding cannot meet nutritional requirements, leading to undernutrition and weight loss for more than 3 months without improvement. Studies have supported PEG as a way to improve undernutrition in DMD patients. In conclusion, dietary management plays a crucial role in the therapy and management of DMD, as there are many risk factors associated with over and undernutrition, as I have discussed throughout this video. It is important to closely and persistently monitor the health and nutritional status of the patient for any issues involving over or undernutrition that may occur. Caregivers of DMD patients should work closely with health specialists and other professionals for guidance of different aspects of care, including the nutrition and diet aspect, to improve the quality of life for those with DMD. And that concludes this video. I hope that you found this helpful, and thank you for your attention.